Good morning, everybody. Dr. John with Orlando Alternative Health, licensed acupuncture physician here with another video just going over some things that you may not know that could be beneficial with you. So today we're going to talk about two different conditions, the first of which is adhesive capsulitis. You may know it in the simpler form as frozen shoulder. Frozen shoulder is a condition which highly affects women much more than men. It can be very painful. Generally, the arm movement is heavily restricted. And from my experience, many people are left with a lot of questions. They'll try a lot of different treatments and then develop a lot of frustration because they don't get the proper treatment and are left kind of feeling lost and with the loss of mobility essentially of one arm. So that is why I wanted to do this video, to bring a little light to some things that we can do to treat frozen shoulder in the proper way. So the way that we look at frozen shoulder treatment is there are multiple phases that a patient may experience through the progression of the condition. And they may start off with an inflammatory condition in the shoulder. There may be actually a more systemic inflammatory condition that the body is going for, and the patient may not even be aware of that. So what I mean with that, it may be something like an autoimmune condition, and just the response from the immune system will cause systemic inflammation, thank you, throughout the body, and will lead to a series of issues. However, getting back to specifically frozen shoulder, we have found very good success utilizing a combination of electroacupuncture, dry needling, and various manual techniques after proper assessment of the patient. So many people I find utilize these treatments as kind of a last resort, and they try many of the more traditional treatments previously, and they may have success, but many times I find, especially something like frozen shoulder, there are not a lot of treatments out there that can speak to a high success rate with them. And I feel that electroacupuncture and dry needling treatments are able to produce that. Now, does that mean one treatment? No. There will be a course of treatment, and a trained clinician will be able to discuss that with you. But the point of this video is basically to bring light the possibility that there are treatments out there that you may not be aware of. And that is the first condition. So the second condition that I'm going to be talking about today is carpal tunnel syndrome. Now, many of you, again, I've talked about this in previous videos, many of you now still probably find yourselves working at home. You may have a nice ergonomic setup where you have proper body condition, your posture is correct when you are in an office environment, sitting at a desk, or possibly even one of those desks that has the ability to allow you to stand nowadays, which will not put as much pressure on various areas of the body, causing imbalances. So that's why I wanted to talk about carpal tunnel syndrome specifically, because various imbalances through tissue, poor ergonomics, and body positioning while one is sitting at the desk for long periods of time can surely be a contributing factor to this condition. Now, this is another condition which we can highly treat with good success utilizing electroacupuncture, dry needling, and manual techniques. Again, you need to properly assess it. This condition specifically, I really wanted to bring light to because I find that There are some people that have surgery and it turns out to heavily benefit them. There are also people that I find have surgery and they get no results or it's worse. So I think surgery can do wonderful things. There are constantly great advances in it. However, surgery should be a last resort. It shouldn't be a first go-to. It's not there. Yes, there are some conditions that if you have a bullet wound, for example, you're going to want surgery initially. But with many conditions, there are things before you get to that ultimate case where you make the decision to have surgery and cut open to the body, essentially, that there are things available that you may not know of. So carpal tunnel syndrome, we can use electric acupuncture, dry needling, and we can also incorporate various soft tissue techniques which will help to reestablish the function and, more importantly for you probably, take away your pain. Because I have literally never had a patient come to me and say, I think I had like 10 needles in me today. That's not what it's about. You want your pain taken away and you want your function restored so you can get back to life and feeling better and doing what you do. So anyway, if you have any questions about carpal tunnel syndrome or frozen shoulder, you can check me out. My website is orlandoalternativehealth.com. On Instagram, it is Orlando Alternative Health. And feel free to shoot me a message if you have any questions. I'm happy to answer. Hope you enjoyed the video today. Feel free to comment, subscribe, let me know your thoughts, and that will be it for today. Have a good one.